Edwina Pereira retired in 2019 as the Executive Director of Child First Foundation, which is a budding NGO focusing on promoting child safety, well-being, and health. And she was the Director Training for Training in International Services Association, INSA-India, with over 30 years of facilitating public health development, child protection, HIV, gender and evaluation in several countries. She's a health management graduate of Global Health Action, and she dreams of a world where all children grow to their full God-given potential happily. She's also a CRY Research Fellow, through which she explored promoting child safeguarding systems, and this research helped her confidently mainstream child safeguarding and protection systems in nonprofit and faith-based organizations. Her work in Sion Hospital in Mumbai for developing their child protection policy is one of her endeavors, and she also facilitates child safeguarding policies, its implementation, and child participation in their protection. She lives in Bangalore with her spouse, 2 children, and her granddaughter. Welcome, Edwina.
Hi, everyone. It's so great to be part of this webinar. And it's the first for me, by the way. It'd be great for us to discuss on other issues also. But looking at mental health and COVID-19 within the context of children, there's hardly any research that we can go to. So a lot of my presentation is going to be very, very experiential. So Jenelle, can we just go to not the next, but the third slide?
Yes.
And we start with that. Yeah. So we are looking at mental health, and Brian very nicely talked of, how it is distinct for those that have actually experienced COVID-19 infection. And it's like distinct for those that are quarantined or in isolation. It's different for those on the ventilator. Now, out here in India, as well as I've been in touch with some of our participants in Nepal, Bangladesh, checking out with them also how things are there, Australia, Philippines too, just to give you what's happening in this side of the world. I don't think I'm gonna repeat myself, because what Brian said applies out here too. There is a lot of stress, there is depression that's coming up. There are a lot of makeshift counseling groups that have come trying to respond to it. But in a place like even Bangalore, we hardly have people approaching for tele-counseling, hardly. So the few that come in, it's probably 1 call a day. The few that come in, we analyze that to be able to share with you some of the things that they spoke about. In terms of quarantine and isolation, one of the concerns that is hitting us is the stigma and discrimination that people who have COVID are facing. So much so that our government has also brought out certain advertisements that say, do not discriminate against people, but keep yourself isolated so that, or quarantined. The lockdown is real, so that COVID won't spread. So it's COVID and not the person. There have been a few that we spoke to who had been on the ventilator. They are out now. They are so relieved to be out of the hospital, and they are in their homes. And one of the things they talk of is the amount of exercise they need to do now, because they didn't realize muscles that they had not used for about 10 to 15 days. Wasting is kind of happening, and they need to get them all back into shape. So exercise is something that we are also advocating for those in quarantine and isolation. Dance or exercise. We have a lot of musicians in our family, and they have their shows on YouTube, and there's a lot of dance that's happening within homes, and zooming for that connection, the social connection that is very, very required. So a lot of promoting mental health programs are on also. See, after all, we are losing control over major aspects of our lives. You know, this is, I mean, COVID, in all that CV that was talked about to us, we didn't really learn about COVID, did we? You know, we have all these so-called degrees and experiences, but COVID is new to all of us. So the loss of control over major aspects of our lives is something that is real. And now to actually look at what do we have control over makes things balanced. So looking at, okay, I have control over making my schedule of the day. I have control, thank God I have internet, you know, and I have control over the connections I have. I can have daily talks with the old people in our you know, in our locality. I choose to talk to parents who have very small children and see how is it that I can de-stress with them. Those are some of the things, and let them know that there are things that we can still control. We do have control over different aspects of our lives now. For the moment, because the lockdown is something that's very real in our country and quite a few countries in this side of the world also. Brian spoke about the depression, so I'm not talking about those, but another that we are looking at is recalibrating mental health specialist services. When I say that is, we are looking at how we can put in protective measures in psychiatric hospitals. What are the practical steps in setting up telepsychiatry and counseling consultations, etc.? It's different. Those are things that also need to be taken care of. Now, can we go to the next slide, Jenelle? Jenelle? Hello? Okay, let me continue. See, all of us are at risk, and with all of us being at risk, we need to look at DABDA, you know, go back into our DABDA where, you know, I know there was a lot of denial in our side of, you know, the world. Denial that COVID could affect us. Yeah, it was something in China, but no, us, no. You know, it took Italy and the others to wake our country up, that it is real. The lockdown is kind of in certain places now, and there's a lot of releases in other places. And what we find is a lot of them are walking around. There's no social distancing. See, India is a country where people have been very, very close. I still remember a time when I was abroad and in a bank, and they told me, hey, stand far away because, you know, you don't have to stand right next to the person that is there. In India, we are just after each other. Our buses are crowded. Our streets are crowded. People cough and they cough. So spitting is something that happens. People have learned through COVID about social distancing, but are they going to keep it when there isn't police and the other volunteers around? It's a stress for me to think of it also. There is a major concern because all are at risk. Who are more at risk? Jenelle, if you can hear me, please change the slide. Have I lost y'all?
Nope, we're here.
Okay, y'all are here. Okay, so are we on the brain slide? Yes,
we are.
So, yes. So the ones that are more at risk in our country are especially the millennials and the Generation Z, because especially the boys, they don't, with the patriarchal nature of families, there was a lot more freedom given to the boys, and they listen to the parents. The responsible mother has no say, and there is a lot of concern because the boys are not really looking at keeping the mask on or keeping their social distancing. The roads are empty, so they've taken their motorbikes and they're zooming on highways, etc. There is a lot, and they feel this is something that's invented in the West, and it's not really real out here. That is a concern for a lot of people. So the next slide. Yeah, in times of COVID, parenting becomes really, it is very, very challenging. I have a 5-month-old grandchild, a granddaughter, and it's amazing. This little granddaughter at 3 months, 4 months, was used to a particular routine, and suddenly that routine was changed. And with that routine being changed, she was in the house all the time. Till we decided my house is just 5 minutes away. Let's put the mask and we can move between their house and our house. The moment the mask is on, she's so thrilled. So, you don't know what kind of stress is there. At 5 o'clock every evening, if we don't take her, she is absolutely restless. Now, I've had to speak to so many children and explain to them in demystified terms what a germ is, why we need to wash our hands, and why we need to, not go outside. And now there are a few comic books that have come out, and we are sharing it with them. This is the time where children are used to school holidays, and they are used to, having these summer camps, and suddenly there's nothing. People are inventing online camps for children now, but that doesn't actually reach everyone. The digital divide is very, very clear at this particular moment, because those schools also that have children that have the laptop and internet in their homes are continuing with studies, but the children in government schools or children who don't have that access are left out. What Brian spoke about in terms of parenting is something that is really required, because parenting worry and stress of parenting is something that is real today. One other thing, you have, tips on the slides, so I'm not talking really about it. One other thing that we are introspecting on is, see, you have maybe a doctor couple that run a clinic, and in the clinic, they are bosses and they're assertive, and they have a say. But when they come home, that same couple, the wife takes on the wifely roles, and the husband takes on the husband roles. Uh, so even though they've both been at work, when they come home, the wife gets into the kitchen and sees to the children, and the husband sits outside with the newspaper or the TV and the remote in the hand, because he's very tired. Okay, and now with lockdown, it's become very difficult. It's become difficult, and there's been a lot of violence. The rate of violence in our countries has increased. We know through the counseling calls we get that child sexual abuse has increased 90% more than it was. It was 53% earlier, but now the number of calls to the 1098, which is the child helpline, is much, much more. So in places where there was some kind of gender equality exposure, things are, kind of getting new, and there's been a change in responsibilities, with children also being given responsibilities, husbands taking on responsibilities, and there's been stronger families that are coming, and the children are benefiting. I know, especially with very small children, having both parents present all the time with them and participating with them is making children say, can this go on forever? Can the lockdown continue? Because now see, mommy and daddy are playing with us, but that's not all the time. You have a lot of violence that is happening, and the calls to violence is going to increase from today onwards, because the government has decided they are losing a lot of revenue with not selling alcohol, and they've opened the alcohol shops. So you have lockdown and alcohol. That's going to be difficult. So yeah, apart from what Brian said, exercise and dance is great. It's really, really great if all do it together too. And adopting an adventure mindset is also something creative. Doing things creatively with children really helps. Validating their feelings is something that is very, very important too. But more than anything, parents need to take care of themselves. It's okay to take breaks in between. It's okay to say I'm stressed and I need a timeout. It's okay to want time away from the children. It's fine. Next. Take care of yourself too. It is required, and whatever parenting codes I said for children, apply it to yourself too. So the next slide. So I'm gonna ask all my viewers at the moment, what are you feeling today? What are you feeling just now? How much are we in touch with our own feelings? I'll never forget Sylvia Solton-Fuss from Global Health Action. And this is something I learned from her. And as I talk to you all, I'm remembering her, talking about how important feelings were, and how there's no feeling that's a bad feeling. Just applying that really would help also. Next. And be in touch with your feelings more times a day. Okay, the next. I want each one of you to think of the way you use your televisions. If there's a a program that you don't like, or it's getting you irritated, the first thing you'll do is take that remote and shift to a channel that is something that makes you feel relaxed and happy and, feel good. Do the same thing with your thoughts. You cannot control your feelings, but we can kind of convert our thoughts. The first thought, the automatic thought that comes to us, is mostly a thought that is negative, especially with this COVID and lockdown. Negative. The moment there was someone 2 streets down that had COVID, the rest in our area decided that, oh, we are all at risk and we are all going to die. So that's that unhelpful thought, the automatic thought that comes. But we can switch that to how the next step, we can switch the next slide, please. We can switch it, because thoughts affect our feelings and then the resulting action. So if our thought is, this person has COVID and I can get it, and with COVID, I will definitely die. We can convert that particular thought to how real is it? Where have I had a contact with that particular person? Have I kept the lockdown rules for myself? I can change my thought to, yes, I need to respect the lockdown because that is there for a reason. And this gives me an opportunity to maybe clean up my house or watch more TV or whatever it is that makes us feel a little better. And the resultant action then would not be so stressful. Brian spoke about stress being high. One way in which we can reduce the stress is by this remote management. Change our thought, convert the thought. And let's talk about that a little more. The next slide. To be able to convert the thought, we can look at how, we can ask ourselves these questions, the questions that are coming up on your screen. We can ask, like, what is the proof that our thoughts are true? How do you know these thoughts are true? Are there some facts that we are ignoring or overlooking? How realistic are our thoughts and expectations? Are there any other ways we can view the situation? How might someone else? I always look at my mother, she's so positive all the time. How would mom look at a situation like this? So have someone that you can zing on to who would view a situation. Talk to that person too. Realistically, what is the chance of something like this happening? Okay, next slide, please. So changing that thought, is it helpful for us to think that way? The moment, if a remote on a TV is used to change one irritating channel to a channel we'd like to, we can do it with our thoughts too. So it is helpful for it. If it is not helpful for us to think that way, convert it. What will help us to remain calmer? So just remember this triangle: the thoughts create feelings, feelings create behavior. And if our behavior leads to, with stress going into violence out here, it's something that we should not be doing. So anything unhelpful is something that is harming me or harming others, something that I do that's harming others, or articles around us. So if we can change that, why not? So to me, the lockdown, today I've actually come back from a funeral. My son-in-law's grandmother died today. And instead of having a mass in church, we just had the priest come home, and he wanted to know there were not more than 20 people in the house. And we had to keep it to a small gathering at home and then direct to the, to the mm, graveyard. And we had to say the prayers ourselves because there was no priest there. So we can, think unhelpfully and say, oh, the lockdown, see, because of that, this particular soul is not going to go to heaven, etc. But what's the proof in that? And can we think another way? And we do know that if God has taken auntie at this particular time, then God will see that her soul is out there, and feel calmer about it. So I'd like to end by the last slide, please. Acknowledging children. I've learned so much from them. Acknowledging Child First Foundation that I worked with. International Services Association, or INSA-India, that is a branch of Global Health Action. And Global Health Action, you all are champions for this. Thank you.
Excellent. Thank you so very, very much, Edwina. This has been quite exciting. And Brian, Dr. McGregor, thank you so much for sharing. I'd like to take a moment to kind of ask you all some of these questions. And we've had some really good, I think, questions popping up in the chat. Dr. McGregor, thank you so much for talking about mental health and the idea that, the looking at New York City, looking at the increase, 300% increase, and we're talking about March, 300% increase in calls to the mental health helpline. And then we're talking about Edwina in India, where you're looking at the child sexual abuse and the numbers with the hotline, and you're seeing a 90% increase in calls and reaching out and saying, hey, we're seeing all of these challenges. You're seeing in New York City, you're seeing actually in the US, an 85% increase in gun sales, an overwhelming sense of fear of what's going to happen around mental health and either during and or after this pandemic. And so a lot of fear, a lot of concern. And then at the same time, I think, Edwina, you shared about, on one end, there's a lot of stressors and parents are feeling that depending on their relationships, there's increased abuse or there's increased cohesiveness in the family. And so children deciding and saying, hey, I'd like to learn more. I'd like to see this happen a little bit longer because mom and dad are here. Then on the other hand, the abuses. One of the things that we've seen pop up as well has been an issue of quarantining and stigma. And so you brought that up. And so I think there's so much that you've shared here. It's so rich. In the last few minutes that we do have, I want to post a couple of questions that popped up in our chat box. And just let's see how we can respond to those. And then, of course, I've got my own questions for you guys as well.
Yeah.
So again, thank you both for your incredible presentations. I know you was just about touching, like the tip of the iceberg with this, but I would say, let me say this. I'm going to say my first question, and then I'm going to go to a question from the chat box. But again, right, it might be a basic question, but why is mental health important to even discuss and talk about? I think a lot of times people think mental health is an issue or a topic that you really only look at when they're the people who are who have problems or who have troubles and can't handle life, right? There's this sort of negative, and there's been a stigma around dealing with mental health. I know in the US and I know across the world in various contexts and cultures, mental health is not something people talk about or discuss. It's definitely been stigmatized. So I would love for you guys to address that. And then I'm also going to ask another question to back that up as well. So one of the things that came up, we got a question from Kenya, from Isaiah. He says, thank you so much for sharing the presentation. And thank you, Dr. McGregor, for sharing. My question is, how effective is online psychosocial support or counseling, especially for those in quarantine or isolation, since they've already been nicknamed COVID-19 victims, which is in itself, very traumatizing? So that's my first question to Brian. And then my first question to, well, my second question to Edwina is, you know, you talked about thoughts, feelings, and behavior, and you talked about changing cultural norms, behavioral norms, like a funeral. We're experiencing scenarios where, you know, someone goes into the hospital, nothing related to COVID-19, but because of the pandemic here, families are not allowed to come alongside their loved ones, and a loved one then passes away. And so just the trauma of not being able to have a sense of closure is extremely challenging for folks who are dealing with grief and trauma. And so I think one of those things is sort of, you know, how to help folks think about, again, what are those thoughts, what are those behaviors, what are those feelings to address when you're dealing with, you cannot, right, allow for this continued social norm. So thank you for sharing what you did share. So I'm going to ask you guys both to respond to that first overarching question about why mental health, right? In the US, this is the Mental Health Month awareness, but that's not why we're having this conversation. It is definitely something that we do believe is critical. So please, Dr. McGregor, please, Edwina, Ms. Pereira, please share with us what your thoughts are.
Yeah, I'll quickly touch on the first question, which I think is an important question to ask and to continue asking and responding to, because the stigma around mental health, as you said, is still very alive and well, and is still limiting folks access to care and just ability to live healthy lives. And so I think that mental health has, unfortunately, very much so in the United States and elsewhere as well, been discussed in a very stigmatized way, and mostly around the illness part of the mental health continuum. A lot of what you hear and see is stereotype views of people with mental illness, which allows the mental health and mental illness to be sort of marginalized and compartmentalized, that this only affects this part of the population. It's over here somewhere, and I'm not crazy, so why do I need to discuss and talk about it and deal with it? But if you look at mental health and wellness on a continuum, we're all on that continuum somewhere. And to the extent that different ways to talk about mental health that destigmatizes it, it is, I think, important when you consider that emotional health and wellness and stress are all sort of related words that I've been using in my career to get people to have conversations about how they're feeling and the relationship between their mental health and their physical health, which is the second point I wanted to make. They've also historically been discussed as two separate things, and there's no intersection between the two, but I mean, they absolutely play off one another. Your mental health definitely impacts your physical health and vice versa. And so not only has it been discussed as separate, our healthcare system for a very long time treated them separately, but with strategies like integrated care and the patient-centered medical home that brings them together and understands that, you know, the whole person has to be treated in order to achieve optimal health and wellness, I think is an important comment around why mental health is so important. It's very integral to how we think, how we feel. So that's what I would offer in response to that first question. I'll pause if Edwina has some additional comments on that.
Thanks, Brian. Yeah, out here in India, the government also has changed. The primary health centers are no longer primary health centers. They are health and wellness centers. and yoga, etc., is a big part of the health and wellness centers. It's advocated for hypertension, and for diabetes. There are things that are also for reducing stress. So right down to the rural area, the government was looking at health and well-being through these health and wellness centers. Now, why mental health? You mean to say, definitely that stigma is still there, you know, for mental health, for mental illness. The stigma is out there. Calls for counseling. No, only mad people go for counseling, you know, is the general way in which people think. But slowly, there's one person that will talk to the other, and there are more calls coming in for counseling. Now, why mental health? I'm looking at it in terms of, you know, the actions people take. Risk, there's denial that COVID is a big problem. That denial can be taken care of. So we are looking at that continuum of well-being, you know, the continuum. And in that continuum, if we can look at different people as to where they are, take their feelings into consideration. So there itself, the relationship between mental health and physical health, I mean, people separated, but in our body, it's one body, right? It's one body. So the first thing that happened with the lockdown was see that everyone is in their houses. The next thing that happened was a whole lot of counselors got together and said, we need to provide a support system. You know, so it's mental health would see to the reduction of violence in our societies. Definitely children would be safer. There'd be less abuse. Yeah, the stress and the depression. There are studies that show that, you know, any kind of trauma in early years lead to depression in later years. 50 years down the line, that child, I don't know what that child's situation is going to be unless that child is supported now.
Very
so mental
good.
health. That's
Thank
why.
you so much. Thank you so much, Edwina and Brian. And I think we're literally at the top of the hour, which we expected that we'd have so much to share. And we did get at least one question through. I think we'll extend this for another 2 minutes as folks are still on the call, and ask that you guys, if we can kind of sum this up. There was one question, as you heard Brian, really around online and virtual counseling and that support. And then Edwina, there was a question about sort of trauma and stress, trauma around children, babies, infants, especially those that are infected, and how is the care being addressed for those children, especially with bonding and the like. But really also about, you know, folks struggling with how to communicate around COVID-19 with their children. And so I'd love for you guys, like I said, in the next 2 minutes, if you can kind of help to summarize and kind of speak to those as well, that would be super helpful. And then of course, folks, everyone, you can join the conversation online on Facebook and Twitter, and we'll certainly allow for that. And please note that on our website, globalhealthaction.org, we will have the recording of this webinar post this call. So please note that. Thank you all for sharing, for coming, and we'll allow our guest speakers to sort of close us out a little bit with some of the responses. Thank you. And I think, Brian, you're still on mute.
Yeah. Okay. Yeah, the trauma that children are going to go through, there'll need to be a whole lot more studies that are to be done on it. And maybe GHA can take a lead on that. but there have been children that have missed their immunizations, because who
Yes.
wants to go into a hospital situation now? You know, there have been children that have missed seeing either a parent who is in another city or grandparents. There have been a little older children like my son-in-law's cousins, who were not able to come to that funeral. So how do they achieve closure? So in terms of virtual counseling, we find having these kind of video chats useful, because at least we can see a little of the expressions. Telephonic counseling, people generally come to the point, it's not like the traditional counseling where it takes time for people to come to the point. In India, they come to the point, hey, listen, this is worrying me, and you tell me what to do, and then we turn it around and get them to look at their strengths and how do they handle similar stresses before, and what do they think they can do now. So that in a nutshell, there's a lot of gray area, there's a lot we don't know, and let's learn together. Thank you.
Very well. Thank you so much, Edwina. Brian. Dr.
Yeah,
McGregor.
thanks, Edwina. I think you really touched on a lot of important points with the telemental health and the video conferencing for health. I just want to add a couple more things to that. There's definitely a lot of data still emerging, but it's clear that telemental health is providing benefits to folks and can achieve some of the outcomes that they're looking for in terms of reducing stress and improving their mental wellness. So that research is clear. Obviously, for those who have limited access to transportation, it removes that barrier to mental health care, being able to engage your mental health professional wherever you are. Also, it saves costs as well on that transportation, even if you have access, but you're looking, you want to save some time and also gas money. You also you see evidence that it addresses stigma for some. A lot of mental health systems and services, people have this stigma around being seen going to the mental hospital. I know that integrated care addresses that as well, because the services are often co-located. But everybody in Atlanta knows where sort of the public mental health system is. But if you're engaging right in your own home, in the privacy of your own home, you have some anonymity that way. And so those are definitely some of the benefits. And obviously that's very much a part of the conversation today. So I've seen some evidence that it's important to, well, not important, but it's beneficial, I should say, for that first encounter to be face-to-face. Sometimes that helps establish the rapport that then continues to build through a video conferencing. But when that's not available, as might be the case in today's climate, you're still in a much better situation where if you can have some professional support guide you through, how to protect yourself and how to maintain positive health and well-being. And as Edwina pointed out, a lot of it is very solution focused. It's like, what are the problems? Can be anyway. What are the problems? What issues and challenges need to be addressed? And let's come up with ways to get you back feeling well. So just to wrap up, I just wanted to point out that what we're really talking about, and I think it's important to look at mental health on a continuum from you know, all the way from sort of health promotion and wellness, you know, for people who otherwise are doing well, but want to achieve optimal health, mental health, and wellness. I think that's important for just folks in general, so that the stresses and strains of everyday life in this new environment don't overwhelm and cause a problem to develop. But for those who already have mental health problems or conditions, and the severity is much worse, you know, we want to talk about the best ways to treat those folks, people who you know, may have diagnoses of depression and anxiety and mental illness. Certainly connecting with staying connected with loved ones and some of those things that's important, generally speaking, but also identifying those resources where you are, so that you can connect with mental health professionals, I think is particularly important. So, you know, just as a sort of a global community, how do we stay connected and keep each other in sort of the best possible environment, so that we can you know, achieve mental and emotional wellness, I think is, you know, just an important thing to make sure that we're paying attention to in these days and times. So that's all for now.
Thank you. Edwina, Brian, thank you all so much. I think this was really, really powerful. And I mean, I think we went over a few minutes, you know, in the hour, and I believe that really speaks to, you know, this is a deep topic. And I think this is definitely fodder for potentially some more time that we probably need to specific areas even the more, and to get into some details. And thank everyone for who's, you know, those who've been asking questions, those who've been participating, listening. Again, this will be on our website. If not today, it'll be certainly there next week. We will also have some mental health resources on the COVID-19 response or resource page. And we will continue to have future webinars. Next week's will be focusing on community engagement within the COVID-19 perspective, and really looking at children and families, and really kind of hitting some of these topics that we've begun to discuss here. Again, everyone, thank you so much. We appreciate your presence. We look forward to future conversations. This is our one down, and we've got a couple more to go. So thanks again, and have a safe and healthy and well weekend and the next few days. So thanks again. Have a great day.
Thank
Goodbye.
you.
Thank you.
Be well, everyone.
Bye-bye. Thank you.
Thank you from this side of the world.
Thank you, Edwina. Good night.
Good night.
Bye-bye.